Hi, this is Sharon Weinstein, and on behalf of the Global Education Development Institute of the United States, I'm delighted to welcome you and to be a part of this year's ICN. And what an amazing year, what an amazing past 24 months it has been. This session is entitled Reimaging Global Leadership Development Post-Pandemic, a Pathway to Change. Let's get started with the first slide. The objectives for this session are identify the role of the global leader in a pandemic, describe the pathway to change and best practices, discuss the need to reimagine global leadership. I have no conflicts of interest, but let's face it, the more you face, the more you overcome. Since March of 2020, we've experienced disruption in every aspect of our lives. The initial reaction was intense on the healthcare side, perhaps not taken as seriously among some in our communities, in our lives, in our institutions, in our countries. We've seen crisis, fear, struggle, and anxiety. We've seen shock, confusion, and disbelief. And yet, day after day, we managed the unexpected on all fronts. Nurses were tested in every way imaginable during 2020 and well into 2021. And nursing has again been named by Gallup as the most trusted of the professions. The more you face, the more you overcome. We're now in a new reality with pandemic preparedness, health disasters, the need to do more with less, a pathway to change and what's in our toolbox, the pulse of our future, and best practices. Let's examine them one at a time. When we think pandemic preparedness, we're always prepared. That is our mantra. As health professionals, we've got this, but this is the time more than ever before to rise up and to lead through, to deal with crisis, even if it's one after another, and to demonstrate our resilience. In health disasters, we're challenged to do more with less. Supply chain has been a huge disruption all over the world. We need to communicate better with our suppliers, with our managers, with our team, with our institutions. We need to communicate better with our teammates and with those we serve. We need to have positive reactions, always remaining upfront, always remaining positive, demonstrating calm confidence, and demonstrating through results that we can do this. We've got it. We know our pathway to change, and we know what's needed in our toolbox. It's the need to stay in communication and in touch with those who are not near you. If they live in your building, if they work in your facility, if they live in your town, if they're your relatives, and perhaps you're distanced by miles or mountains because maybe they're elderly or infirm, you can still use the internet to remain in touch, with or without a mask, depending upon the guidelines in your country. Follow those guidelines and make that an important component of your own toolbox. Stay in touch with and connected with your children and your loved ones more than ever before. Young kids who are schooling from home and challenged by having to go back to institutions that are not yet ready for them need your support more than ever before. And at the same time, yes, at that same time, you need to take the opportunity to take better care of yourself, because you will be and are prone to burnout. Let's look at the future pulse. Let's take control of what we do and of how we do it. Do what you do best. Save lives. Do what you love. Save lives. Meditate every day, every week, whenever possible, and celebrate your success and the successes of your teammates. Make sure that you recognize their contributions every day and in every way to the outcomes that you are able to produce. This is such an important time to look at our pulse and the pulse of our profession, to take charge, to take control, and to deliver best practices. Act with urgency. As a former emergency room nurse, I always consider myself to be in urgent state. I act as if every single person with whom I have an encounter is the most important person in my life. And that's how we act when we're in the healthcare professions. We act with urgency. Time certainly is a priority. Communicate with kindness and clarity. I was so proud of my daughter this year when she recorded a song called Kindness is King. It was so important to me that the words were so meaningful and that my husband and I got to be a part of her video. Be the leader others can and will trust. We can reimagine global leadership. Yes, we have supply chain disruptions. We've been there before. We can deal with it. We're overcoming many of the obstacles. Yes, we have vaccine and testing mandates, and perhaps not as many people as you would expect are in fact vaccinated in your community or in your country. In some countries, those who receive 2 doses of the Moderna or Pfizer vaccine are now getting boosters. And of course, we can reimagine global leadership through nurse supply and demand. We're well aware, let's face it, that many of our colleagues are opting to leave the profession. They no longer can deal with the stress and with the demands that are put on them, on their time and on their mental state. Suicide among health professionals is rampant, and we need to be more observant and more aware. If at all possible, we need to stay in the profession. We need to help develop the next cadre of nurses who will be taking care of us and our loved ones. Now is the time to meet the supply and the demand. There is or may be a silver lining. We've transformed healthcare. We've looked at how healthcare is delivered and increased telemedicine. We've taken time for family and self. We have newfound respect and have seen it from communities for our frontline providers. And we are addressing emotional and mental health. This is the time to reimagine global leadership. This is our time to follow the theme, to nurse the world together. Safeguard the health and safety of your team, revive demand, reboot operations and your mindset, apply technology, and let's make this happen. Thank you so much for sharing with me today. Together, we reimagined global leadership post-pandemic. This was our opportunity to nurse the world together. Again, thanks for sharing with me today. Enjoy the rest of your conference.